Why would a woman want to use a weak estrogen like Estriol for her menopause symptoms? I'm Steve Goldring, the hormone pharmacist from simplehormones.com. I've earned multiple certifications about hormone replacement therapy. I like to focus on what are called bioidentical hormones. Those are hormones that are exactly the same as the hormones that are made by the human body. Doctors all over the US, as well as Canada, and even a few in the UK, trust me to teach their patients about bioidentical hormones, especially hormones that are used to treat menopause. Well, maybe you've heard the term Bi-Est, and you've wondered what that term might mean. Well, basically, Bi-Est refers to a combination of two different bioidentical estrogens. One of those estrogens is the weakest form of estrogen, and it's called Estriol. First, a little background about estrogens. The human body makes essentially three different estrogens. It makes a bunch of them, but three primary estrogens: estrone, estradiol, and estriol. Estrone is abbreviated E1. Estrone is mainly made by the adrenal glands and the fat cells after menopause. When you go into menopause, you don't have that much estrogen, but what you do have is mostly estrone. Estradiol, or E2, is the strongest and the most important estrogen. Estradiol mainly comes from the ovaries, but it can also be made from estrone. Estradiol production from the ovaries gets sort of shut down at menopause. Estradiol is the estrogen that has the biggest impact on menopause symptoms. Things like hot flashes and night sweats, weight gain, vaginal dryness and painful intimacy, mood swings, irritability. Estradiol is also the estrogen that has the biggest impact on osteoporosis, heart disease, and other long-term health risks. Estriol, or E3, is the weakest estrogen. Estriol makes a difference in menopause symptoms, but it takes a lot higher dose to do that. Estriol is mostly made by the placenta during pregnancy. That's why estriol levels go up by maybe 1,000 times in pregnant women. The fact that estriol is so high during pregnancy is one of the features that makes it so interesting. Pregnant women don't get breast cancer very often. When they do get breast cancer, though, they have better odds of surviving compared to women who aren't pregnant. Dr. Henry Lemon at the University of Nebraska conducted a small study in the 1960s showing that estriol caused remission of metastatic breast cancers. Those are cases of breast cancer that have spread to the bone, very serious cases. Other researchers showed some interesting correlations between estriol levels and breast cancer. Asian women living in Asia tended to have both higher levels of estriol and lower rates of breast cancer. American women had lower levels of estriol and higher rates of breast cancer. Interestingly enough, Asian women in Hawaii had medium levels of estriol and medium rates of breast cancer. There seemed to be a negative correlation between high estriol and breast cancer being low. Recent studies show that estriol might be useful in slowing down a type of breast cancer called triple negative. Estrogen metabolism is a topic that's way too deep for this video. It's kind of a rabbit hole about how your body breaks down estrogens. Estrone seems to be involved in metabolites that encourage cancer. Estriol, on the other hand, seems to encourage estrogen to break down in what are considered safer pathways. Bi-Est refers to a combination of estradiol, I mentioned the strongest estrogen, along with estriol, the weakest estrogen. The thinking among many doctors has been sort of hedging their bets. Some doctors believe estriol is protective against breast cancer for the reasons I already talked about. So they want to add those protective effects to the estrogens they prescribe to help treat menopause symptoms. The main way this is accomplished is by prescribing a mixture of both estradiol and estriol. The ratio of those two estrogens can be anything your doctor orders, but the most common ratio is 80% estriol, since it's weaker, along with 20% estradiol. This 80-20 estrogen combination can be given in an oral capsule or, more commonly, in a transdermal cream or even an oil base. There are no FDA-approved hormones that contain estriol, at least not anymore. That means you can only get Bi-Est from a compounding pharmacy. BiEst is just as effective for menopause symptoms as estradiol would be by itself. The Estriol hypothesis, that's the idea that estriol is protective against breast cancer, it isn't accepted by all providers who treat menopause symptoms. Estradiol has been extensively studied, but there aren't that many randomized clinical trials looking at estriol. But most providers will admit that estriol does seem to have a pretty good safety profile. If you're looking for a guide who can work with you to navigate menopause, but you're not sure where to start, well, I might be able to help with that. I know some qualified, trained healthcare practitioners who really understand how optimal hormones can do two things for you. They can relieve your menopause symptoms and reduce your long-term health risks at the same time. Click the link that says Find a Provider and I'll see what I can do. If you found this video helpful, click the like and subscribe buttons. You might also want to ding that little bell to get notified anytime I post a new video. Thanks so much for watching, and I'll look forward to talking to you again next time.